I was 17 years old and I was pretty uncertain about what I was going to do with my life. And my dad was an ENT over in Cleveland. He said, well, just come on in, shadow me for a day, and if you like it, great. If not, no big deal. You can find something else to do. I shadowed my dad and saw a few tubes and tonsils, which were great, but one of his friends is a cardiac surgeon. He said, hey, we're getting started in the heart room in a little bit. Maybe John wants to peek his head in there and check that out. I walked in and saw my first open heart surgery at that time and kind of fell in love with the medical field and surgery. Because for me, it sort of crystallized the most logical, greatest thing that mankind can do. We found a way to use science in order to deliver good, compassionate care to people, and that's why I wanted to go into medicine. I try and treat the entire patient completely. It's not just about going in there and fixing the gallbladder or fixing the hernia or whatever. It's to try and get a holistic, total view of the patient themselves and to try and have them be, an active participant in their own health care. As a surgeon, I'll do the operation, I can advise and counsel, but they've got to have the full knowledge, the full understanding, they've got to have the same ownership in their care just as much as I do. So it's more of a partnership, really, and that's kind of my big philosophy for practice. I want a patient to feel both well-informed as well as empowered. Surgery and medicine are advancing at a rapid rate, especially in this day and age. It's important that I'm able to talk to the patient, give them sort of the most up-to-date evidence-based information and break it down for them. And I want them to walk out feeling that they've, picked the right treatment path and gotten the right surgery. The reason why I wanted to practice in the Norwalk community also traces back to where I did my training. West Virginia is a relatively small state, but it's a mountainous one, and there are only 2 major academic medical centers there. So we would have patients driving in from 6 hours away just to get routine health care, and that sort of galvanized me to want to practice in a rural setting. I want to be able to go back to where I consider home, which is northern Ohio, and to be able to provide care for people in their own community without them having to drive a long distance away. They can get the best, most up-to-date care, the safest care possible in their hometown.